Hi, my name is Manda Radulovic, and today I'm going to be talking about how vitamin D supplementation could possibly help alleviate the effects of postpartum depression. So, what is vitamin D? Vitamin D is a fat-soluble vitamin that is naturally occurring in very few foods as well as sunlight. It is absorbed from sunlight when ultraviolet rays from the sun hit the skin and cause vitamin D synthesis. Vitamin D is crucial for many different roles in the body, including calcium absorption, and is essential for healthy bones. A low intake of vitamin D has been correlated with higher rates of mental illnesses, including depression and anxiety. Vitamin D deficiency occurs when your body doesn't absorb the recommended levels of vitamin D, which causes a variety of issues, including brittle bones, cancer, rickets in children, and sometimes mental illnesses like depression and anxiety. Researchers believe that because vitamin D has such an important role in brain function, that this is the reason why it causes mental illnesses. It is also important to understand that many individuals who may not be receiving adequate sunlight or vitamin D from foods, like during the winter months, may be experiencing depression and anxiety, and vitamin D supplementation and/or supplementing with foods that contain adequate vitamin D could be beneficial. Now, what is postpartum depression? Postpartum depression is a mood disorder, and mood disorders like postpartum depression and depression during pregnancy are very common and considered a public health issue. The birth of a baby can trigger many different emotions. Most mothers experience the baby blues for up to 2 weeks after giving birth. The baby blues just usually consist of crying spells and feelings of sadness. This can occur because of many different hormones fluctuating in your body, as well as just the stress of having a newborn child. The baby blues can turn into something much more serious known as postpartum depression. And postpartum depression is not a character flaw nor a weakness, and nor should mothers be shamed for it. Most of the time, postpartum depression is just a symptom of giving birth. There's a certain stigma about mothers being depressed after having a baby because many people believe that this should be the most joyous time in their lives. Most mothers with postpartum depression really struggle with this and feel guilty because it causes a disconnect with their baby. Many of the symptoms include mood swings, anxiety, sadness, crying, feeling overwhelmed, irritability, appetite problems, and trouble sleeping. Postpartum depression can be really serious, and it is important to seek immediate treatment if you are having feelings of hurting yourself, hurting your baby, or hurting others. Now, understanding what postpartum depression is, vitamin D supplementation could be beneficial in helping alleviate the effects or preventing postpartum depression. There was a study conducted in BMC that studied vitamin D supplementation in Iranian mothers in Shiraz, Iran. The trial was done on adult pregnant women with one single live fetus, no pregnancy complications, no history of mental illness, and were about 26 to 28 weeks of gestation. Their depression score had to be between 0 to 13 on the Edinburgh Postnatal Depression Scale. There was 2 groups in the study. One group received a placebo, and the other group received vitamin D supplementation. The vitamin D group received about 2,000 IU units of vitamin D3, which is just the synthetic form of vitamin D, from about 26 to 28 weeks of gestation, or when they started the study, to childbirth. The study showed that the group that received vitamin D supplementation had much higher serum concentration levels of vitamin D, which just means more vitamin D present in their blood. It also showed that they had a much lower depression score on the Edinburgh scale postpartum, as well as right before giving birth. This study is really important because it shows that vitamin D supplementation could help alleviate the effects of postpartum depression and be important in preventing it. There needs to be more research done on this, though. Overall, my message I want to get across to either pregnant women with no history of mental illness or a history of mental illness, mothers who have had postpartum depression or are currently suffering from it, to please try to get sunlight for about 10 to 30 minutes a day, about 3 times weekly if possible. Obviously, this may not be possible for everyone, especially during the winter months when sunlight is very limited. So vitamin D supplementation could be really beneficial. And if you are getting vitamin D through sunlight, please make sure to be wearing sunscreen. Thank you.